when we approach the subject, it's important to reflect on why we vaccinate. We vaccinate to prevent the disease itself, as well as the morbidity and mortality that might come with it, as well as the sequela that might come after it as well. The most important thing we can do is to prevent when regards to infection control. If we're unable to prevent the disease from occurring, then our next two best options are standard precautions and transmission-based precautions. In this portion, we're going to discuss more from a prevention aspect of vaccines, and then subsequently we'll move into, in a different section, we'll talk about standard-based and transmission-based precautions as well. Next slide, please. Vaccine hesitancy. Common sentiments I hear: the vaccine will make me sick. It's better to have had the disease than to receive the vaccine. I've already had the flu. I don't need my flu shot. The vaccine will cause the disease. Next slide, please. When in reality, vaccines are, in fact, they're effective. They're so effective that one dose of MMR is about 93% effective against preventing measles, 78% effective against preventing mumps, and about 97% effective against rubella. And then the second dose can increase that up even further. Vaccines strengthen your body's natural immune defenses. Getting vaccinated is safer than contracting the disease. In fact, now with the introduction of the HPV vaccine, we have a vaccine that can actually prevent cancer. Unfortunately, most of us probably have firsthand knowledge of, either for ourselves or a loved one, of experiencing cancer and how unpredictable that course can be, and even side effects from the medication whenever we have a vaccine that can prevent it from even happening in the first place. Vaccines often do cause mild side effects. The most common tends to be pain at the injection site, redness, swelling, sometimes a little low-grade fever, fatigue, malaise. Vaccines are also continuing to be monitored for safety and efficacy. I get a lot of questions about this in my practice, about when did it come out? What do we know about it? What are we continuing to look for? The VAERS is a vaccine adverse event reporting system, and they continuously accept reports of vaccine safety. Anyone can report, whether a healthcare provider or even a patient as well. Next slide, please. So sometimes vaccines were met with resistance, and this was fueled even more so by the COVID-19 pandemic, as it was more of a fluid state at the time. So mistrust that we often hear about, mistrust about what are the ingredients, are they safe to go in my body or my child's body? Mistrust about what is the vaccine actually preventing. A lot of people have never experienced anyone that's had measles, thankfully, but they don't understand, is it a real threat or not to them and their family as well. I've had some families with mistrust regarding, we're saying that we're vaccinating against influenza. Well, how do I know that they didn't sneak the COVID vaccine in there somehow? Uncertainty about what is my true risk. If I don't get this vaccine, will I truly end up with the disease? Or is my child going to be at increased risk? And what about possible side effects? Politicization, again, fueled again since the COVID pandemic as well. And then lack of adequate information. We live in a society that often goes to social media for guidance. They're receiving information from sources that aren't credible, yet they're a lot of times willing to believe them over healthcare professionals with valid information to offer. In reality, vaccines are among the greatest public health achievements of modern times. They've saved millions of lives throughout the world, and most patients and healthcare workers don't have firsthand experience of a lot of these devastating consequences of many of the disease we prevent, because vaccines have been so successful. Unfortunately, due to vaccine refusal, we're starting to see some of these outbreaks of the communicable diseases, such as measles. Before the measles vaccine was introduced, between about 400 to 500 people died in the US every year. Next slide, please. So if we know vaccines are so important and so successful, what can we do to try to increase these rates back up to what they were. Some thoughts would be having vaccine ambassadors. And these more specifically are talking again amongst us as healthcare providers in our offices, in our hospitals. Who can we try to help kind of bolster the discussion about vaccines as well? So trusted individuals here. And again, providing resources to back that up. So referring to the CDC guidelines or the AAP guidelines as well. Medical provider vaccine standardization. So over the past few years, I've had the opportunity to work at a variety of different offices. And between the different offices, they will have slightly different schedules, which can sometimes throw off parents if they're expecting one vaccine and the provider is providing a different vaccine. So trying to make sure that we're all following the same guidelines as well, so that parents come to know and expect what they can be receiving at that visit. Ensuring to send reminders about when vaccines are due. During adolescence, a lot of times we'll have gaps in care as they are having more time in between vaccines that might be mandated from the school. Usually when children are smaller, less than 2, we see these children very often, very frequently. So we have the opportunity to have these conversations quite frequently and help provide that relationship. But during adolescence, we tend to kind of stray a little bit more. So trying to make sure to remind everyone how important it is and to send out those reminders too when it comes to flu season, whether it's through an email, a text, or a phone call reminders, especially reminding to come back in the fall. So their well visits could be a different time of year. So reminding them, make sure we come back in the fall to get our flu shot or to get our COVID shot too. And then two, from a healthcare provider work environment standpoint, reminding everyone to, get their flu shot. And I'm sure most healthcare facilities do a pretty good job of that, but just understanding the importance of trying to first and foremost prevent anything from happening. Financial incentives, they were some success with the strategy during the COVID-19 pandemic. And then having workplace vaccine programs where you don't have to leave during working hours, that someone comes to you or comes around the hospital or you meet at a certain location during your set working hours, and making sure too to cover different shifts as well. Some of those later day shifts might be more challenging, but trying to make sure that everyone has access and equal opportunity to those as well. And then providing effective messages delivered by trusted messengers too. So ensuring that the message that we're trying to convey is accurate, that it's concise, providing resources to back it up, and then combating misinformation. This can be tiring to constantly feel like we're fighting against the current, but keeping in mind that what we're doing isn't in vain, that we're trying to prevent unnecessary morbidity and mortality, and even unnecessarily strain on our healthcare infrastructure. I'm sure most of us were impacted by the COVID-19 pandemic and everything that followed from that. So just trying to figure out best practices to try to minimize where we might get overburdened by some of the diseases that we can in fact prevent.